Today we will discuss the importance of colonoscopies. This is an examination of the lower part of your gastrointestinal tract.
Doctora Victoria and George.
Doc, what's a colonoscopy?
Well, a colonoscopy is a procedure that allows us to examine your colon or large intestines. We use a device called a colonoscope, which is inserted through the anus and passed through your entire colon.
How long does the procedure usually take?
The actual procedure usually takes between 20 minutes to an hour. It depends on the individual case. But there is some preparation that is done beforehand, and that takes time.
What are the reasons someone might need a colonoscopy?
Well, there's various reasons for this, George. Commonly, we perform colonoscopies to screen for colon polyps or colon cancer. Additionally, if someone experiences rectal bleeding, that is blood out the rear end, sometimes a change in bowel habits, iron deficiency anemia, or maybe they have a family or personal history of colon cancer, a colonoscopy may be recommended. Chronic unexplained abdominal or rectal pain or an abnormal x-ray exam may also be a reason to consider the procedure. And when it comes to family history, we normally start screening at 45 years of age for colon cancer. But if a family member has a history of colon cancer, we want to start 10 years before they got it. For example, someone had colon cancer diagnosed at 50. We would start at 40 years of age. But if someone got it at 60 years of age, we wouldn't start at 50 because we normally start screening at 45. Since that comes earlier, that individual who had the family member with colon cancer at 60, they're just going to be on a regular schedule.
How do I prepare for a colonoscopy?
Well, you gird your loins. Preparation is crucial for an effective colonoscopy. You will need to avoid solid food for at least 1 day before the test and drink plenty of clear fluids. The instructions will be provided by the surgeon's or gastroenterologist's office and will guide you through the preparation process, including how to take the laxative and whether any changes to your medications or diet are necessary. This is the worst part of the whole thing. You will likely be up all night with the runs and getting to know your toilet a little more than you wanted to. And when you do the procedure, all the fluid gets sucked out, so you're back to your normal self, albeit a little extra tired from running to the loo all night. And that laxative, sometimes it's a gross liquid you have to drink. Sometimes it's just some pills. I'll be honest, I screen the surgeons I send my patients to find out what their prep is. Most folks hate the liquid. I only like to send my patients to a doctor who does that pill prep. It's usually tolerated much better. Sometimes you still need the liquid one though. It's kind of miserable, I'm not going to lie. And as for who will be giving you those instructions, again, it's usually general surgeons and gastroenterologists who do the colonoscopy. But sometimes it's a family doctor too. We do those, especially when family docs are in more rural areas.
Liquids in, liquids out. What kind of liquids can I have?
So you can drink clear liquids like water, clear broth, coffee or tea without milk, ices, and gelatin like JellO, but avoid red JellO. Red liquids should be avoided. Having red in there can make it hard to see if you have an active bleeding spot in the colon. As well, high fiber foods, seeds, nuts are all better avoided in the week before the procedure.
I love red JellO. It's my favorite color. Is there anything else I should know?
Well, yes, you should inform your doctor about all the medicines you're taking, including prescriptions and non-prescription ones. Some medications may need to be stopped temporarily before the procedure to reduce the risk of heavy bleeding. Other things like diabetes medicines, they might be stopped too.
Will I need someone to take me home after this colonoscopy?
Well, most patients receive a sedative during the colonoscopy, so you definitely will need someone to take you home afterwards. It will make you maybe a little sleepy or loopy, but it usually doesn't knock you out all the way for the most part. The sedative can also cause changes in your reflexes and judgment, similar to the effect of alcohol. So it's not safe for you to drive. Sometimes you can go back to work right away, but it depends on the time of day. And some doctors will recommend that you don't drive at all that day.
This is pretty good stuff, Doc. Hey, all you watching, go subscribe and let us know what else you want to hear about in the comments. I mean, you're already hearing about my colonoscopies. Who knows what's next? Speaking of what else, what can I expect during this procedure?
You will be given fluids and medications through an IV line, which will maybe make you feel relaxed or even sleep a little bit during the test. The colonoscope is a long, flexible tube which will be inserted into your colon, and air or carbon dioxide will be pumped into the colon to help visualize the linings. Biopsies or polyp removal may also occur during the procedure. The nice thing about colonoscopies is that they are both diagnostic, they can find out if you have a problem in the colon, and therapeutic. If there is something bad, it can be taken out in the moment.
Are there any risks involved?
While colonoscopies are generally safe, complications can occur. These include bleeding, tears or holes in the lining of the colon, side effects from sedative medicine, and the possibility of missing an abnormal area within the colon.
What should I do if I experience any issues after the procedure?
If you have severe abdominal pain, a bloated abdomen, vomiting or fever, or significant side effects, you should call the doctor who did the procedure right away.
I see. Thanks for explaining everything, Doctora.
You bet, George. And depending on what is found in terms of polyps or even cancer cells, people will be put on usually a 3-year, 5-year, or 10-year schedule. If everything looks good, 10 years. 10 years to get another colonoscopy. If not, then one needs to be done earlier. It's essential to undergo a colonoscopy when recommended, as it can provide valuable information about your colon health, and when polyps are taken out, it helps them from turning into cancer cells or leading to blood loss. If you have any other questions or concerns, let me know. And viewers, if you've got questions, leave them below as well.
I will. Thanks, Doc.
Want to learn some more about health topics? Take a look here, or how about over here? Thank you for joining us today, our healthcare team. We hope that you'll join us next time. Bye-bye.